How is everybody? I've got great news for you. There are hardly any speakers left between you and the after party. Hardly. You're not there yet. You haven't earned it. You need to earn it. I got a question. Do you love Bernie Sanders as much as I do? What's the matter with you people? Bernie Sanders, are we talking about the same person? All right, let me tell you why I love Bernie Sanders, okay? So, I don't do any illegal drugs. I don't drink. I don't smoke. I don't swear from the podium. But I do have my drug of choice. My drug of choice is irony. And Bernie Sanders is my dealer. Bernie Sanders, I'm an irony junkie, and that man is the gift that keeps on giving. Bernie Sanders is what? He's a champion of the poor. He wants to lift the poor out of poverty. He hates discrimination. So you would think that Bernie, if there's a policy out there that would lift hundreds of millions of the world's poor out of poverty, that would make us wealthier at the same time, Bernie Sanders would be there. He would be for it. You would think that he would be in favor of free movement of peoples across national borders. You would think that this policy, which economists estimate would double gross world product, Bernie would be on that. It would make the poor wealthier. It would make us wealthier. Is Bernie Sanders for that? Absolutely not. Bernie Sanders will even tell you which countries he especially doesn't want, or which nationalities he doesn't want coming into the United States. That is some serious irony right there. Will he let the decentralized market mechanisms of supply and demand determine the optimal allocation of labor? Absolutely not. He's the man who's going to determine that. As I say, for an irony junkie, that is good stuff. But in my own area of healthcare, I also love him. I love the guy. Why? Because he pays libertarians the highest possible compliment. He steals our ideals. He steals our ideals. What does Bernie Sanders say about healthcare? Come on, you haven't been bashful so far. What does he say about healthcare? Everybody has a fundamental human right to high-quality health care. Enacting a single-payer Medicare for All program would give everyone equal access to high-quality universal care. If you have any issues with my Bernie impersonation, here's what I propose. After my talk, we'll meet at the bar. You can do your Bernie impersonation. If it's better, I'll buy you a Shirley Temple. I'm the sole judge. Okay. But these are our ideals. Rights, individual rights, equality, universal access to high-quality care. These are libertarian ideals. These are ours. Okay, you're probably a little skeptical at this point, but take healthcare rights. Do we have rights when it comes to our healthcare? Absolutely we do, Comrade Sanders. Our most important healthcare right is the right to make our own health decisions. You have a right to control your earnings. If the government took away 100% of your earnings and left you with no money, do you really have any right to make your own health care decisions anymore? It'd be hard unless you're, bartering or stitching up your own wounds or something like that. You have a right to buy, say, oral contraceptives from any willing seller. A fundamental human right, because these things are health care. You have a right to enter the market for health services by starting a new hospital or a new imaging center or ambulatory surgical center and trying to offer people something better than what they have right now. And as a patient, you have a right to patronize those establishments. These are rights. What about equality? Well, there's lots of inequality. This is another libertarian ideal. There's lots of inequality in the world, okay? Jeff Bezos and I, we have equal rights and equal dignity and all that, but we're not equal. We're not equal. He could buy and sell me several times over. I'm also much better looking than he is. So there's all sorts of inequality. Some of it's good, some of it's bad. But the worst kind of inequality that exists is when someone can use force to overcome the will of another. Okay? That is our ideal. We are the movement that is trying to stamp out the worst form of inequality on earth. Universal access. Universal access. You know, one of the great things about decentralized markets is they make everything more universal. And it's true in healthcare as well. Markets are constantly coming up with innovations that make healthcare better and more affordable and more secure. Innovations like health insurance that stays with you after you get sick, that doesn't drop you, and allows you to keep paying healthy person premiums, that makes you less likely to end up uninsured than if you got health insurance through an employer. Innovations that make health insurance cost 70% less than Obamacare. Innovations like nurse practitioners, staff, clinics that reduce the cost of primary care 30% or more relative to getting primary care from a physician's office. Innovations like dental hygienists practicing independently, dental therapists that are driving down the cost of dental care. All of these sorts of innovations, improving the quality of health care and driving down the price so that more and more people can afford it, making healthcare more universal and preventing people from falling through the cracks of our health sector. But, or at least they should be, these innovations should be doing that, but they're not doing that. And why? It's because Bernie doesn't mean it. It's because Bernie and others who believe in a robust role for government in healthcare are putting in place policies that block these and other innovations over and over again that are driving up the cost of healthcare and pulling down the quality of healthcare. Bernie Sanders doesn't mean any of it. Not the part about healthcare rights or the part about equality, much less the part about universal access. What about healthcare rights? You have a right to make your own health decisions. Bernie Sanders doesn't respect that right. Enacting his single-payer Medicare for All program, which, by the way, no country in the world has ever enacted anything like it. Even if you believe his very optimistic assumptions about how this would work, it would still require Congress to double federal taxes. You remember our good friend FICA? You know, that guy who Shaquille O'Neal said, if I ever meet this FICA guy, I'm going to punch him in the face. Double it. Your income tax liability, double it. And it still wouldn't pay for all of Medicare for All, but it would also take away your right, some of your rights to make your health care decisions. And on top of that, the same interventionist philosophy, that same interventionist philosophy takes away all sorts of health care rights. Can you, like residents of 100 other countries around the world, walk into a pharmacy and buy birth control pills without a prescription? No. Here in the United States, you need a prescription. Why? Because the Food and Drug Administration requires it. This is a product that's been on the market for 60 years. Women know how to use this safely. 100 other countries around the world allow women to buy it without a prescription, but here in the United States, the federal government, Congress, but also federal bureaucrats have made the decision that you need a permission slip from a government-appointed gatekeeper, we call them doctors, in order to buy this product. They have taken away your rights. Same thing with what we call certificate of need laws at the state level. I mentioned you have a right to start a new healthcare concern, a hospital, an imaging center, an ambulatory surgical center. You have a right to invest in new equipment if you've already got one of those facilities. You have a right to put another wing on your hospital if that's what you want to do. In 35 states, this philosophy of Bernie Sanders and the left has produced laws that we call certificate of need laws, where the government doesn't just make you prove to their satisfaction that you are going to, run a high quality hospital, which, by the way, those licensing regulations don't really improve quality. They actually make you prove to the satisfaction of government bureaucrats that the community needs this new facility or needs this new MRI. If we were respecting healthcare rights, what would determine whether a community needs a new hospital? You would. You would cast your dollar votes. And if it was a lousy hospital, the market takes care of that. But government takes away your health care rights by making in 35 states, by making new health care facilities get a government permission slip after proving to the government that the community needs your services. And by the way, on the day the government is making that decision about whether the community needs your new imaging center or your new hospital, who shows up for that hearing? All the existing imaging centers and all the existing hospitals saying, no, 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 we've already taken care of all of the need in this community. And is that equality? Does it sound like, moving on from rights to equality, does this sound like equality? If the government can fine you, ultimately put you in jail if you start an unauthorized hospital? If you refuse to pay Bernie Sanders' new Medicare tax, Medicare for all tax, what happens? Well, the government sends you a letter, then they send you another one saying we're going to fine you, then you ignore that and someone comes to your home with some bracelets for you to wear and they take you to jail. Yes, yes, my friend, they do that. And then there's due process, but ultimately they put you in prison. They say Bernie Sanders is taking away your rights here, but would you say that you're equal to Bernie Sanders in this scenario that he envisions? Would you say that you and the man who comes to your home with the bracelets are equals, or the judge who's putting you away, or the prison guard who will shoot you if you try to leave? Bernie Sanders is not trying to promote equality here. When the federal bureaucrats tell you you can't buy birth control over the counter, would you say you and that FDA bureaucrat are equals? This is not equality that Bernie Sanders is promoting, or that government intervention in healthcare promotes. And it certainly doesn't promote universality. Hardly anything has done more to make healthcare less universal in the United States than the Medicare program on which Bernie Sanders wants to model the entire system. Medicare causes the cracks in our health sector. Yes, it throws tons of money at health care for seniors. Almost $1 trillion a year. But it also causes the cracks in our health sector to widen in innumerable ways. It encourages, rewards low-quality care while punishing high-quality care. Low-quality care like medical errors, hospital-acquired infections. It increases the cost of health care by increasing the prices the people in the private sector have to pay. That causes the cracks in our health sector to widen so that more people can fall through. When people complain that the US health sector is so expensive, they're largely complaining about Medicare. This does not improve universality. This actually makes universality harder to achieve. The FDA doesn't help here either, because when it says you have to get that permission slip from a government-appointed gatekeeper in order to buy birth control, or naloxone, which reverses opioid overdoses, or countless other medications that you have a right to buy from any willing seller, but the FDA requires you to get a prescription first, it increases the prices for these products. Not just that, I mean, obviously it increases the cost because there's the monetary cost of seeing the doctor, there's the time cost of seeing the doctor. It also increases the prices of these things. Prices go up when the FDA imposes a prescription requirement, and they fall when those prescription requirements go away. And certificate of need laws also don't make healthcare more universal. They make it less universal. They have a negative impact on quality. They increase prices because when you have less entry, you get more consolidation, less competition, and higher prices. All of these things are not making healthcare more universal. They're making it less universal. They're blocking the market's ability to do this. So interventionism in healthcare, this philosophy that Bernie Sanders espouses, his ideas, not the ideals to which he appeals, but his actual ideas, they aren't about protecting rights. They aren't about equality. They aren't about improving healthcare. They're about power. They're about letting Bernie Sanders and a lot of people in a distant capital make your healthcare decisions for you. It's about the pursuit of concentrated power. And it's delivering, for all of us, much, much worse healthcare than we would get if we would respect healthcare rights. Restoring your healthcare rights and decentralizing that decision-making in healthcare all the way down to the level of the individual consumer and the individual entrepreneur is not only right, it is literally a matter of life and death. With that, folks, I want to thank you for your time. I want to thank Yal and Lauren for having me here. Take care and good night.